Welcome to the show, the Resource Hour. Dr. David Klein of the Stages of Life. They are in Longwood, Florida. Well worth the drive. Get to meet the doctor, take a look around. You'll see the laboratory. It's a beautiful facility, and I tell you what, they're ready to serve you. Yes, all of you villagers that are looking for someplace to go for your health care, check it out. And at the end of this segment, you'll hear a phone number. Make sure you call that number. But today, we're going to talk about depression. Wow. There's a lot of people that feel depressed, even though, what is it, the national news that's bringing them there? Is it the toppling statues? What in the world's going on that people are so depressed, or is it chemically induced?
Well, I don't know, okay? But, we have a national bird. It's the bald eagle. We have a national anthem. And I think we have a national disease. That would be depression, okay? It is ubiquitous. This is the sort of thing that happens a great deal. It costs a lot of lives every year. Okay, it's just one of those sorts of things that people die from depression. They die from hypertension, they die from cancer, but they do, in fact, die from depression. How does this happen? Okay, well, depression will influence, it will occur, it will manifest in approximately 33%, that's 1/3 of the population at any one time over the next 5 years. So you have a 33% chance over the next 5 years of suffering from a clinically significant depression. If you are or have had a history of depression in the past, it's far more likely that you're going to have a reoccurrence in the next 3 years, about 50% likelihood. Now, not all depression is life-threatening. Not all depression is so severe that you need to be scraped off the floor. So, there are varying degrees of depression from, I feel a little bit blue, a little bit depressed, a little melancholy, to somebody who becomes neurovegetative, okay, or psychotic depression. But depression is depression. What does this mean? Well, it manifests in a lot of different ways. It can mean that you just simply are unable to enjoy life. That's called anhedonia. Probably the most common of all complaints. I just don't feel like doing anything. I just can't motivate. I don't get any pleasure out of what used to bring me pleasure before. I can't sleep at night. Probably the number 2 symptom. What does this mean? Well, it means that you can't get to bed. That's one type of depressive symptom. But the more common one is that you wake up early in the morning and can't get back to bed. It's called late insomnia. Now, how do people treat their depression? More people treat their own depression than go seek a doctor. More people see a family practice physician to treat their depression than go to a psychiatrist. So how do most people treat their depression? Well, if you're a woman, female, girl, gal, call it what you want, you tend to eat to treat your depression. This is not a misogynistic statement. It happens to be a statement of fact. Women eat when they're depressed.
You're mean.
I'm mean, but I'm being truthful. Don't kill the messenger. Another day, another 10-minute segment. What do men do? They drink. Now, is this true across the board? Not necessarily, but it's far more likely. When you're looking at the greater weight of evidence, 55-60% of women are going to eat rather than drink, and the flip is true with men. It is what it is. So when you're out there treating obesity, one of the very first things that you have to do is ascertain as a physician, as a clinician, whether or not this is an eating disorder or whether this is a depressive problem, whether it's a medicative issue or whether or not it's endocrine, hormonal. There are lots of different ways that people can get sick. Now, what's the number 1 symptom of hypothyroidism, men and women? It's depression. Is hypothyroidism common? Yes, it is. Okay, so what's depression all about, and why do we really care? Because it's just a fantastically great source of lost productivity. Your kids, teenagers, lots and lots of problems with the depression. We just think they're crazy, and well, they might be. Okay, but depression costs teenage lives as well. We all hear about the kids that go to college and hang themselves or jump out of buildings. We hear about the high school kids that go off and commit suicide. We hear about the kids that do worse things to each other and then commit suicide. It's a big problem, and it needs to be addressed in a directed, very sober way. So what do? We look to ourselves first. What do I do if I start to demonstrate these symptoms? Do I just go ahead and isolate myself? Is my spouse, my girlfriend, or my kid, are they necessarily going to understand what the signs and symptoms of depression might be? Usually not. You really can't depend on other people for much of anything, actually, but you certainly can't depend upon it for this. When you're looking at family clusters, okay, as a general rule, objectivity is thrown right out the window. Okay, if you're looking at a spouse who's depressed, what do you see? You see somebody who doesn't want to do their chores. You see somebody who's sitting watching television. You see somebody who's drinking too much. You see somebody who won't get out of bed. And what do you think? That's one lazy SOB. Okay, the same thing is true of the teenage kids looking at the parents or the parents looking at the kids. You tend not to see things objectively, so you have to stand back. Don't expect your family necessarily to be there to intervene for you. So what are the signs and symptoms of depression? Okay, number one is drinking in excess, eating in excess, weight gain, smoking too much, oddly enough, and drug abuse. People look to treat themselves to make themselves feel better. So what is it about food that makes you feel better? Oddly enough, high fructose corn syrup is more addictive than cocaine. It will give you a bump. It will make you feel better. And that is typical of what women do to start feeling better. What do men do? They look to dopamine. Dopamine, how interesting is that? So what are they doing? Alcohol, smoking. They tend to kill themselves that way. Either way, you're killing yourself just a little bit more slowly or a little bit more rapidly, but it is what it is. Now, what can you do to treat yourself? Well, the very first thing that you want to do is if you think there's an outside chance that you might have clinical depression, you call your doctor, for God's sake. That's what they're there for. It's very, very easy to treat blood pressure. It's fairly easily treated in terms of diabetes. But when you're treating depression, it takes a little bit more time and it is a little bit dicier. Why is that? It's like shopping for shoes. You really don't know what the right intervention is going to be for any one person for this particular illness. There are way too many variables that you can't see. But you have to give this a shot and you have to be patient with it. The second thing you need to do is to make yourself sleep better. Not longer necessarily, but better. What does this mean? It means sleep hygiene. You can take a normal, healthy individual, somebody without any problems medically at all, and make them depressed by simply depriving them of a normal night's rest over the course of about 1 to 2 weeks. It does not take long for this to happen. If I took a thumbtack and taped it to your buttock, it would keep you from sleeping. Okay, every time you'd roll over, it would jam you. It would make you wake up. 3 or 4 days later, you're getting pretty crabby. 2 or 3 weeks after that, you're clinically depressed. 6 to 8 weeks into it, it's almost irreversible. So these things have to be addressed. So there's certain types of pain conditions that can cause depression. Well, how does this work? Okay, well, you're taking your pain medications on a round-the-clock basis because that's what my doctor told me I had to do. I'm taking long-acting opiates because that's what the state told me I had to do. Or this is what happens. The opiates tend to shut down the adrenal glands. As this happens, melatonin gets suppressed. So guess what? The treatment of the pain causes depression. Now, that doesn't sound like such a great idea. Okay, so what are we doing? We're exchanging one problem for another. What about those sinus infections that you have? Those steroids that you're taking also shut down the adrenals, which in fact will cause depression as well. So there are medical causes of depression which may be no more difficult to figure out than by looking in your medicine chest, because what you were doing under a doctor's instruction may well be causing your depression. Oh, what do you know about that? But if the docs don't hear about it, if the docs are not kept in the loop, there's nothing anybody can do about it. So this really absolutely needs to be addressed.
Isn't it a downward spiral until they seek help? Because the more they drink, the more they eat, the more they get depressed because they're what they're doing to themselves.
Well, yeah,
they feel worse, and then they feel worse about feeling worse.
It can work that way. Okay, there are people that'll take a downward course, and it will continue that way. But far more commonly, actually, are those people that remain mediocre. Okay, they will have low-grade depression for their entire life. It's just that those individuals that you go to a party, they're the ones you really don't want to talk to because they are mopey, depressed, and they suck the life out of you. These are the individuals that go through their entire life depressed, do nothing about it, but they will drag everybody else down. True enough, there are people that will take the downward spiral. They'll drink themselves to death. They will do drugs to death. They will eat themselves to death. But it's a long, slow process.
All right, very good. Now, stages of life, vitamins stagesoflifevitamins.com. Visit that site and you'll see that the nutraceuticals that you have to rush out and get because you've already run out, or you get to suffering over 2 or 3 days because you can't make the trip, well, this alleviates all of those problems. stagesoflifevitamins.net. And to find out more about the good doctor, suffernomore.com, suffernomore.com, and here is more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.